Hi, good evening to everybody. Thank you for joining me. Today I'm going to be focusing on two clips from a recent hearing and an article that has been made around it. And this article is around the Democrats scolding Marjorie Taylor Greene for vulgarity and conspiracy in a vaccine hearing. I'm going to play her clip and the response as well from Robert Garcia, who is also Republican. So this is a bit of a political issue, but at the center of it are real people. And this is what I want to highlight. I'm not particularly focused on what intentions the politicians have for being pro or against, but the mere fact that there are so few who seem to be standing up to defend or to make sure that they are dealt with in a proper way. So, why don't we start with the clip that I think had caused so much controversy at the time with regards to Marjorie? And let me just make sure I've got the correct one. And here we go. Let's see what she had to say.
The same.
Oh, sorry, this was the response. So here we go with Marjorie's clip.
Mr. Chairman, I'm not a doctor, but I have a Ph.D. in recognizing bullshit when I hear it. I'd like to point out to everyone that we knew early on, as a matter of fact, everyone knew early on, that the people that were at risk of hospitalization and dying of COVID were those that were obese, had diabetes, were over the age of 65. We also knew that children were at no risk, practically zero risk of being hospitalized or deaths from COVID-19. We knew that young people, healthy young people, were not at risk. However, Dr. Marks, you rushed through this process of authorizing these vaccines, even though you knew the side effects, you knew about myocarditis, and you knew about the studies. So let's be very real about the situation that we have. Here we have, let's talk about the reports on VAERS. Some people in here are trying to belittle these reports, but these reports come from people that died, people that got injured. And in December, in the middle of December, I think it was the 10th or the 11th, the first vaccine was approved. It was authorized under emergency use. Boom, 10,596 reports in less than a month. 2021, 706,767 reports on VAERS for vaccine injuries and deaths. 2022, it was 206,676. 2023, and it went going down because the mandates stopped. Now, let's talk a little bit more about the vaccines. Here we have reports. Deaths, 18,372. Permanent disability, 17,842. Hospitalizations, 86,452. Emergency room or office visits, 315,048. Serious adverse events, 113,449. This is from the Congressional Research Service about VAERS.
I'm just going to pause there a minute and highlight what she's talking about are real statistics, whatever anyone's position is, whether they are pro or if they're anti. And this is what I think is part of the problem. We have people who are on two sides of the fence and are not willing to look at what's in the middle. And it's always been shown, because I did interview and speak to the vaccine injured, and one of their main issues is that they were pro-vax, got injured, they were inconvenient for the pro-vax side of things, so they were ignored. And then people who were anti vax criticized them for taking the vaccine in the first place. And so they are left in no man's land. And this is where they have become a bit of a political football. And that's what's really disappointing, is that in reality, we have a situation where people are genuinely needing help. But because of the politics, they are left to the sideline. So that's the point that I think we shouldn't lose sight of. These are real numbers, real people who have been affected. What is happening to them? Let's continue to listen to her.
All kinds of injuries, miscarriages, heart attacks, myocarditis, permanent disability, neurological problems. And it goes on and on and on. These are the reports from people being forced to take vaccines. Shouldn't have happened. Mr. Grimes, I've just told you the numbers of reports. However, under CICP, there are only 10,640 of these COVID-19 claims are currently pending or are in review. And as of January 1st, 2024, CICP only compensated 11 of the 40. Oh, wait, let's make that number clear to everyone. Only 11 people have been compensated. Only 11 people have been compensated. Out of the 40 COVID-19 claims it determined were eligible, only 40 were determined eligible. That is amazing. And the average award was only about $3,700. On the other hand, the average VICP payout over the last 35 years is approximately $490,000. If you die or get injured from a COVID-19 vaccine, your average payout's $3,700. I'd like to recognize someone in the room today is here, Brianne Dressen. She's met with you, Dr. Marks. She's met privately with you about her vaccine injuries. She participated in a clinical trial. She was injured, and then she was dropped from the trial for the COVID-19 vaccines. Her medical expenses are $433,000 a year. She filed with CICP. Mr. Grimes, she's gotten no response. She's right here. Could you raise your hand, Ms. Dressen, please? Thank you. Perhaps you could meet with her after this meeting. Dr. Marks, you admitted to her that vaccine injuries are real, that they're real. Although you rushed through the authorization, and now you've authorized that children should receive these vaccines, and even babies as young as 6 months old. That is shameful. That's shameful. I'm not asking you a question. I'm going to continue speaking. Thank you. This is my time. The National Institute of Health also saw Ms. Dressen for her neurological complications that have been quite severe. They studied her, and then they dropped the study and asked her to be quiet about it. These are the real stories of the vaccine injured. They were totally, completely wiped off of social media. There's been thousands of peer-reviewed medical studies, thousands of them studying vaccine injuries. They are real. People are dying. People are having heart attacks, strokes, blood clots, and many other countries are dropping the COVID-19 vaccine and saying we shouldn't give them to children. It's time to be honest about the vaccine injured, and we need to stop allowing these COVID-19 vaccines to be given out to children.
So she has clearly strong views on this, and this is part of the issue that they don't like from a political point of view. But there is no doubt that people are injured, and there is no doubt that we should be doing more, not only to compensate them. Compensating people is only part of the problem. It's why have there been so many VAERS reports? What is the mechanism? Now, when I come from it from a scientific point of view, the two things that have stood out to me is that when we looked at what happens in the general cohort of people, Israel's study had shown this, what we call hypermetabolic lymphadenopathy, where there is a proportion of people who, even up to almost 25 days to a month after having been vaccinated, they have much higher responses in their lymph nodes. It may be that that's part of the issue. But the point is that there has been so little focus on trying to understand what are the mechanisms that they have become sidelined. So it's not just about the fact that people have been injured. And you're talking about 3,700 payout. Now, if you told them that at the beginning, I suspect that you would have had a different perspective. But the point being is that whichever way we look at it, more science should have been done to understand these mechanisms, to understand why it occurs, who does it occur in, and if there was any way to try and mitigate it. So let's hear the response from the same day. And this was again quite political. So it was also from a Republican. So this is not just about Democrat Republican. So let's hear Robert Garcia make a response now.
Same person that we know that has, on countless posts, has spread misinformation, encouraged parents to refuse routine vaccinations for their children, which you just heard, by the way, and even compared our pandemic efforts responses to the Holocaust. I want to just actually read something which is in the public record. I'm not saying anything that's not in the public record. That a member of this committee actually said, the same person that is actually attacking vaccines, said that vaccinated employees get a vaccination logo, just like the Nazis forced Jewish people to wear a gold star. I want to read that again. Vaccinated employees get a vaccination logo, just like the Nazis forced Jewish people to wear a gold star. That is the level of insanity and attacks that we are having here as we actually debate the lives saved around vaccinations. Now, this same member has also held shadow public hearings promoting ideas that COVID is a bioweapon to target people of specific races and that vaccines, and I quote, cause turbo cancers. I want to read you this quote, and it's again in the public record at a hearing. Have the COVID vaccines resulted in an increase in cancers, and are turbo cancers real? Now, Mr. Chairman, this is, in my opinion, just insanity. We know that's not the case. Dr. Marks, can you clarify once again for the American people, do the COVID vaccines cause turbo cancers?
I'm a oncologist that's board certified. I don't know what a turbo cancer is. It was a term that was used first in a paper in mouse experiments describing an inflammatory response. We have not detected any increase in cancers with the COVID-19 vaccines.
Thank you. And I'm thinking.
It's important to note right at the end there that he'd said that they have not seen any increase in cancers in relation to the COVID vaccines. And that's true. But is it because we've looked for it or because it's actually true? One of the things that I had recently pointed out, and if you want to see the presentation, it's on my Substack in the link below. The point is that cancer is increasing. Turbo cancer, I think people are referring to the fact that by the time people are diagnosed, they are oftentimes at a stage 4 cancer where there's metastatic disease or they have very aggressive cancer. And that's probably the context that it's in. I would caution anyone who discounts this that we definitely haven't done enough research on this. Cancer is up. We just need to look at all of the variables to make sure that everything is taken into consideration because there could be things that can be mitigated. But back to the point here is that the way that they dealt with her response, because what she was talking about is the fact that people who had been injured were not compensated adequately and there didn't seem to be enough research. The response was then to try and take her down politically and making a connection between what she had said between about the star on somebody who had been vaccinated and so on. Now, she may have said that, and I think that in her response here to this, it did highlight that she apologized. I'll show you here. So it seems as though it highlights here the Hill reported that Greene later apologized for that tweet where she had compared vaccination logos on employees to Jewish people forced to wear the Star of David in Nazi Germany. The point being about that is that whilst that may have been inappropriate comparison, it doesn't discount what she was talking about, that there were very high levels of VAERS reporting. Only 40 were thought to be appropriate for compensation, and of that 40, only 11 were compensated. And of that 11 who were compensated, their compensation amount was $3,700. That can't be right, and I don't think that's justifiable. My question is, why is it that when we've had a situation where politicians have been insisting, and you have to remember, mandates did not come from the scientific community, those came from the political community. The mandates means that you have to take responsibility for the actions. You have to take responsibility for the outcomes. And it seems as though more and more politicians are trying to sidestep that responsibility instead of pushing the scientific community to find answers. That doesn't seem right. And it's very important that we need more politicians, whatever their interests are, to stand up and advocate for people who are vaccine injured, because the implications in the long term, because you have to realize that the people who are injured recognize the connection. What of those who are injured but haven't made the connection? Because sometimes injuries don't happen immediately, and therefore they could be having a vaccine injury and had no connection between the time frame of having it and their symptoms and disease. The scientific community, the clinical community needs to understand it better. There's a lot of work that needs to be done. And it's very important that if we are going to make any forward headway for the science and trying to reduce the damage that has been occurred in public perception for science, for health, for vaccines generally, we need to be honest, just as she was saying right at the end. I picked up the points that really stand out. There needs to be more honesty, recognition of failures, and critically, an intention and determination to find solutions. Thank you very much. Have a great evening.